Dr. Spagnolo, please go ahead.
Mr. Chairman, we've submitted a written testimony, and I would ask that you have that entered into the record. I will try to keep my few comments here fairly brief. Thank you for having us here, and thank the distinguished members of the committee for having us here. We certainly appreciate it. I am here as a practicing physician with more than 4 decades with the VA, and I'm here also as the president of the National Association of VA Physicians and Dentists, usually referred to as NAVAP. I might add, too, that I am a veteran, having served for 2 years of active duty in the United States Public Health Service. The National Association of VA Physicians and Dentists is a 501c6 nonprofit organization that is dedicated to improving the quality of patient care in the VA healthcare system and ensuring the doctor-patient relationship is maintained and strengthened. I appear today in pursuit of that purpose. This year is NAVAP's celebration of its 40th year. NAVAP believes that a key means of enhancing care of veterans is by employing the best physicians and dentists. NAVAP believes it is essential for physicians to be involved in decisions regarding delivery and quality of health care. During my many years with the VA, I have witnessed firsthand many changes in the VA, some good, some not so good. I've had the opportunity to meet nearly all the secretaries of the VA over the last 40 years. I get to know several of them very well, and a few I've seen as patients. I believe all of these individuals have been good people and all of the best intentions. I am sure Secretary McDonald, who I have also met with, also has good intentions. Notwithstanding the good intentions of these good people, however, the role of the physician within the system as a leader of medical care has greatly diminished over this same period. Today, most physicians and dentists feel like their opinions are neither helpful nor requested. At many centers, physicians and dentists are no longer even considered professionals, but referred to simply as workers. These observations come from our members, VA docs and dentists, men and women who want to help improve veterans' care. In the late 1960s and 70s, nearly all VA medical centers were led by directors who were physicians. Today, very few medical centers have physician directors. The position now called the VA Undersecretary of Health was known as the Chief Medical Director. At that time, there was a direct line from the Chief of Staff at the medical center to the Chief Medical Director. Issues of delivery and quality of medical care were raised and addressed by medical professionals. Today, Chiefs of Staff report to a clinical specialist at the VISN centers. In more recent times, there has also been a strong movement to eliminate the need even to have a physician in the role of Undersecretary of Health. I ask, would it be wise or even possible to run the Defense Department without generals and admirals in leadership positions? We are not saying there's no role for non-physicians in the administration of hospitals or medical care. We are saying, however, that medical judgment should be based on years of education and patient care. Physicians are being loaded with additional duties more appropriate for non-physicians, such as typing, filing letters, follow-up calls, patient reception, and preparation. Similarly, it's not cost-saving nor efficient to have physicians routinely escort patients from waiting rooms to exam rooms and having them help the patients get undressed. There is a growing trend to add non-physicians, and there is a growing concern that a veteran may never be seen or treated by a physician while in the VA healthcare system. Veterans are seen by non-MD doctors without ever realizing they have not seen a medical doctor. We believe this is dangerous for patients and their families, and it may also raise some ethical issues. The VA is currently considering a change in its nursing handbook. Under the proposed handbook, there will no longer be any physician oversight for the process of sedation and providing operating room anesthesia by certified registered nurse anesthetist. The proposed change provides no guarantee this will provide safer patient care. Additionally, LPNs with little or no psychiatric experience are taking the place of psychiatrists during intake counseling and assessments in some psychiatric departments. Taking care of patients and providing excellent care has a lot to do with providing the basics and using a lot of common sense. For example, when patients are asked what is important to them, you will hear simple, straightforward, common sense questions, such as, will I be admitted quickly? Is the room clean? Is there a bathroom in the room? Does the call button work? And does someone answer and arrive quickly when I need them? Does everyone speak so I can understand them? If I need help to eat, will there be somebody there to help me? Do my doctors and nurses spend time explaining things so that I can understand what is happening? Unfortunately, patient surveys indicate that none of the above questions are being answered very well in the VA. Although the crisis last year in VA did focus on access to care, this is but one small piece of the total package. Getting timely initial access is of little value if it takes months to get your hip replaced or have a lung cancer removed or a colonoscopy screening because there may not be sufficient physicians or adequate access to the operating room. Timely access must be assured throughout the course of care, not just on the initial visit. VA is referred to as a healthcare system. At best, it's a collective of hospitals and other medical facilities operating under a common umbrella. The operation and standards at every facility appear to be different. There must be unification, simplification of process across the organization to achieve an order of efficiency and common outcomes. When you've seen one VA, you've only seen one VA. In this regard, we have seen no recent operational structural changes that would increase the efficiency of physicians and dentists in the VA. Changes announced by the current secretary are not being consistently implemented in local facilities, perhaps because the facility leaders have not understood that these changes are mandatory.
Doctor, you'll have to like clean up your time here.
One sentence left.
Okay, good.
Hearings like this are important and helpful, and the VA appreciates NAVAP appreciates the opportunity to be here today. We want to help fix the medical care problem. The unfortunate truth, however, it's far easier to throw money at the situation than it is to fix it. Thank you, Mr. Chairman.
Thank you, Doctor. Mr. Morris?